This was a massive team effort, a massive team effort.
Having a mass vaccination opportunity is incredibly challenging. It takes a true partnership. The University of Maryland Medical Center and UMS, the School of Medicine, University of Maryland Baltimore campus have all pitched in.
I'm extremely grateful for the partnership between the medical center, the medical system, and UMB in terms of making this a reality, not only for our employees, but for our students, and it's extremely important.
With the partnership, the academic health system working together, realizing the SMC clinic is both an accomplishment for UMB and it's an accomplishment for the university's medical center.
All right, you ready?
This vaccination center that I've just experienced, I think, beautifully exemplifies the foundational synergistic partnership that exists between the University of Maryland, Baltimore, the University of Maryland School of Medicine, and the University of Maryland Medical System.
We knew it would be an SMC Campus Center because we had an existing, what's called a closed point of dispensing site plan or a closed pod plan. It said in the event of a public health emergency, this site would be used for the dispensing of a medical countermeasure or some type of emergency medication to the employees and the students of not just the university, but also the medical center. And so we knew we had that plan, but obviously it was a skeleton plan because we didn't know what the emergency would be. But now that we have an actual emergency, we have the pandemic that we're in, COVID-19, we needed to get much more specific in our planning.
It's been grueling over the last year, managing this pandemic. But when you're working with colleagues who are as dedicated to the mission of healing, caring for our patients and families, as well as keeping our staff safe, getting the vaccine out and in as many arms as possible, it re-energizes you and it reminds you of why you're here, and it reminds you of what the mission is all about.
When we got news that we had vaccine that was going to be coming to the medical center, we began an operation in our auditorium. We very quickly realized we needed to expand, and we were so grateful for this partnership between UMB and the medical center to allow us to now have a really beautiful, slick operations that again is allowing us not only to vaccinate our employees, but also our community.
Throughout this vaccine journey, we have needed to pivot and shift and adjust so quickly, and through all of that, it has been essential to remain innovative and creative. We have really leveraged technology. This will definitely be applied in the future to other projects.
If we need to mobilize our resources and vaccinate large numbers of individuals, both employees as well as patients and community, that we can do it. And I think prior to this, we would not have known that we could do it, but by mobilizing all of the different areas that need to weigh in on this process, that we are able to do that and bring this resource to the community and to our employees.
It was a lot of work, but certainly everybody had yeses as an answer, not a no. We were all aligned with the same task to get down the road and get this vaccination clinic stood up as quickly and efficiently as possible.
It's been great to know that the model that we created was so robust and so effective that now they've taken that model and we've gone from the auditorium to the SMC and now onto the convention center and M&T Bank Stadium, where we're going to be able to vaccinate many more members of the community. So that has been wonderful.